Have you ever felt a strange heaviness in your chest that didn't feel like pain? Just different? A patient once told me she almost missed her heart attack because her symptoms didn't look typical at all. And I want you to imagine this for a moment. Imagine feeling unusually tired, a little breathless, maybe even slightly nauseated, and no one around you realizes that your heart might be the one calling for help. This is the reality for so many women over 60. Their heart symptoms don't always show up as the crushing chest pain we see in movies. Sometimes the signs whisper instead of shout, and that quietness can be dangerous. Women over 60 experience heart symptoms that are very different from men, and those differences are often overlooked or misunderstood, even in medical settings. That's the shocking truth I want to uncover with you today. This matters because heart disease remains the #1 cause of death in older women, yet their early warning signs are subtle, confusing, or easily mistaken for something else. What feels like indigestion may actually be a heart warning. What seems like exhaustion can be a sign of reduced blood flow. Even discomfort in the jaw, shoulder, or upper back can be your heart struggling silently. I once cared for a woman in her mid-60s who insisted she was just tired from a busy week. She had no chest pain at all. What she did have was a deep, unusual fatigue and a faint ache along her jawline. When we examined her more closely, she was actually experiencing a silent heart event. Her body was speaking to her, but the message didn't look like what she expected. And that's exactly why so many women delay getting help. In this video, I want to give you the clarity every woman deserves. We're going to talk about the hidden signs, the misunderstood symptoms, the hormonal changes that reshape heart health after 60, and the life-saving differences in how women's hearts respond under stress. My hope is that by the end, you'll feel empowered, informed, and deeply connected to your own body's wisdom. Stay with me, and if these insights resonate with you, I invite you to subscribe to Senior Health Daily so we can continue this journey towards strength, safety, and long-term heart wellness together. Why women over 60 have different heart symptoms. As we move into this part of our conversation, I want you to imagine sitting with me in my clinic, just the two of us, talking openly about what really happens inside the body as women age. One of the biggest truths I've learned in more than 30 years of caring for older women is this: the female heart ages differently. Not better, not worse, just differently. And that difference changes everything about how symptoms show up, how they feel, and how easily they can be overlooked. For women, the heart and blood vessels are influenced heavily by hormones throughout life. Estrogen, in particular, plays a powerful protective role. It keeps arteries flexible, supports healthy cholesterol levels, reduces inflammation, and helps blood flow more smoothly. But after menopause, that natural shield slowly weakens. It doesn't disappear overnight, but the body begins to lose that built-in protection, and the cardiovascular system has to work harder under the same conditions. This is why heart disease often rises sharply after age 60. The vessels stiffen, blood pressure becomes more unpredictable, and the heart becomes more sensitive to stress, fatigue, and inflammation. But the most fascinating and frustrating part is that women tend to develop heart disease differently than men. Instead of large artery blockages, many women develop something called microvascular disease, problems in the tiny vessels that don't show up clearly on standard tests. These small vessels can restrict blood flow quietly, creating symptoms that don't resemble the classic Hollywood heart attack. Because of this, women often feel discomfort in softer, subtler ways. Their symptoms may not hit the center of the chest. The pain might travel to the jaw, neck, shoulder, or upper back. Instead of sharp, crushing pressure, many women experience heaviness, tightness, or a sense of unease that they can't quite explain. And when symptoms don't match what they expect a heart problem to feel like, they assume it must be something else. I remember one patient who came in after feeling an unusual pressure along her upper back. She said it felt like she'd slept wrong or strained a muscle while carrying groceries. She brushed it off for 2 days before finally telling her daughter, who convinced her to get checked. that muscle strain was actually a sign of reduced blood flow to her heart. She had no chest pain at all, not a single sharp sensation, but her tiny vessels were struggling, and her body was trying to warn her in the only way it could. Another factor many people don't realize is that women's pain pathways process cardiac discomfort differently. The nerves that carry signals from the heart to the brain often create sensations that feel more like indigestion, nausea, or unusual fatigue. So instead of grabbing their chest, women may describe their symptoms as feeling worn out, off, or not myself today. These are meaningful signs, but they're often dismissed because they don't feel dramatic. When you put these pieces together, the hormonal changes, the smaller blood vessels, the altered pain pathways, it becomes clear why older women experience what I call non-classic symptoms. They are real, serious, and sometimes the only early warning the body gives before a major event. Understanding these differences is the first step in protecting your heart. Once you know how your body communicates, you can respond sooner, trust your intuition more deeply, and recognize the subtle whispers before they turn into emergencies. The most common hidden symptoms in women over 60. As we continue this conversation, I want you to take a slow breath and think back to moments in your life when something in your body didn't feel quite right. Not painful, not dramatic, just different. These moments matter, especially for women over 60, because your heart often speaks in whispers long before it ever cries out for help. One of the most surprising truths is that the most common heart symptoms in older women don't look like what we usually imagine. Instead, they often show up in ways that seem unrelated to the heart at first glance. Fatigue is one of the biggest ones. I've had countless women tell me, "I'm just tired," only to later discover that their heart had been struggling for weeks. This isn't the type of tiredness that goes away with a nap. It's a deeper sense of exhaustion that feels unusual for your normal day. That kind of fatigue is your body's quiet way of saying it's working harder to deliver oxygen. Nausea and dizziness are another pair of symptoms many women overlook. When a woman feels slightly nauseated or has a sudden wave of dizziness, she often blames it on something she ate or simply being dehydrated. But these symptoms can signal that the heart isn't getting enough blood, especially in women with microvascular changes. Shortness of breath is one of the most telling signs, yet older women tend to excuse it. They say things like, "I'm out of shape," or "it's just my age," but that's not always true. When your heart is struggling, even small tasks, like climbing a few steps or walking across a room, can leave you more winded than usual. That shift deserves attention. Then there are the symptoms that almost no one associates with the heart: jaw pain, shoulder aching, or a heavy sensation in the upper back. Women often describe these feelings as tension, arthritis, or muscle strain. But the nerves that carry signals from the heart can radiate discomfort into these areas. So what feels like a pulled muscle may actually be a sign of reduced blood flow. Many older women also experience indigestion-like sensations. They think it's reflux, gas, or something they ate. But heart-related discomfort can mimic digestive issues because the nerves around the stomach and heart sit close together. That fullness, burning, or pressure after meals can be your heart struggling, not your stomach. And then there's the emotional side that often gets dismissed: cold sweats, sudden anxiety, or a feeling that something is not right. These aren't just dramatic movie moments, they're real physiological responses when the heart is under stress. As women age, their nervous system becomes more sensitive to fluctuations in blood flow, and these sensations become even more significant. The reason these symptoms appear in unexpected places is because women's nerves detect ischemia, reduced blood flow, differently than men's. Instead of creating sharp chest pain, they may trigger subtle sensations that are easy to overlook or misinterpret. What makes this so important is not just that these symptoms exist, but that they are often the first signs of trouble. And because they don't look like the classic heart attack symptoms we expect, many women delay getting help until the situation becomes dangerous. The body always tries to communicate. The challenge is learning to listen. Silent heart attacks in senior women. There's a term we use in cardiology that still surprises many people: silent heart attack. It sounds impossible, doesn't it? How could something as serious as a heart attack happen without dramatic pain, collapsing on the floor, or clutching your chest? But for senior women, silent heart attacks are far more common than most realize, and they often leave behind lasting damage long before anyone knows what happened. Silent heart attacks don't mean the heart is quiet. They mean the symptoms are quiet. Instead of a sudden, sharp, crushing sensation, women often feel symptoms so mild and so vague that they dismiss them as something ordinary: a bad night of sleep, a stressful day, a stomach issue, a pulled muscle, something they just need to rest off. I've seen this many times in older women. Their signs appear soft, gentle, almost polite. And that politeness is what makes them dangerous. I remember a woman in her late 60s who walked into my office holding her stomach. She told me she thought she was dealing with a simple stomach bug. She felt nauseated, exhausted, and slightly sweaty. She didn't have chest pain, so she didn't think for a moment that her heart could be involved. To her, it seemed like a digestive issue, but as we talked, I noticed subtle clues. Her skin looked pale, her breathing was slightly shallow, and she kept pressing a hand to her upper abdomen as if trying to relieve a pressure she couldn't quite describe. When we ran her tests, it became clear she wasn't battling a stomach bug. She had experienced a silent heart attack earlier that morning. She never once felt chest pain. Instead, her symptoms felt like flu, anxiety, and overwhelming fatigue. And like so many women her age, she had learned to push through discomfort, to care for others before herself, and to label her own symptoms as just life catching up to me. Silent heart attacks often strike women over 60 because their symptoms come from reduced blood flow in tiny vessels, not the dramatic blockages men experience. These microvascular events create sensations that are easy to misunderstand, and because women tend to delay care until they are absolutely sure something is wrong, valuable hours often pass before they seek help. Emotionally, silent attacks leave a lasting impact. Many women feel confused, betrayed by their own bodies, or embarrassed for not recognizing the signs. But the truth is simple: it is not their fault. The body is trying to communicate, but the message comes in a language that women were never taught to recognize. Silent heart attacks also cause long-term scarring on the heart muscle, which can weaken it over time. This can lead to fatigue, breathlessness, and increased risk of future events. The real danger isn't just the attack itself, it's the fact that so many women don't know it happened until months or even years later. Understanding these silent signs is empowering. It gives you the ability to catch problems earlier, to trust your instincts, and to take action when something feels off, even if it doesn't hurt. Your heart doesn't always shout. Sometimes it whispers, and those whispers deserve your attention. Why doctors often miss heart symptoms in women. As we move into this next part, I want to speak honestly about something that frustrates both patients and physicians. Even with all our medical advances, women's heart symptoms are still missed far too often. Not because doctors don't care, but because the female heart simply doesn't follow the traditional script we were all taught in medical school. And when symptoms don't match the textbook, women can slip through the cracks. One of the biggest reasons is that women describe their symptoms differently. Men tend to report sharp, localized chest pain, while women often use phrases like, "I feel off," "I'm unusually tired," or "I have this strange pressure in my jaw." These descriptions are real and meaningful, yet they don't always trigger immediate alarm because they're softer and more subtle. And when a symptom doesn't sound urgent, doctors may unintentionally underestimate it. Another issue is that early heart tests don't always show the problem in women. Many women develop microvascular disease, which affects the tiny blood vessels that standard tests, like basic EKGs, don't always capture well. So a woman may be experiencing real cardiac strain while her early test results look normal. I've seen this many times. A woman describes unusual discomfort. The first test looks fine, and she's told everything is okay. Meanwhile, her heart is still struggling. Chest pain differences also play a major role. Women rarely experience the dramatic, crushing pain we associate with heart attacks. Instead, they may feel neck tightness, shoulder pressure, or upper back heaviness. And when symptoms don't resemble the classic pattern, the diagnosis becomes harder to catch. There's also a deeper emotional layer. Society has conditioned women to be strong, to care for others, to downplay their own discomfort. When a woman finally does speak up about her symptoms, she often starts by apologizing or minimizing what she feels. "I'm probably overreacting. I don't want to bother you. It's probably nothing." And those gentle words can unintentionally influence the way a doctor interprets urgency. It's also true that gender bias in medicine still exists, even if unintentionally. For decades, heart disease was studied primarily in men, and those findings shaped how generations of doctors were taught to identify symptoms. So when a woman shows up without chest pain, or when her tests look okay, it's easy for her true condition to be overlooked. Not out of neglect, but because the medical system historically wasn't built around the female experience. I've seen women told they're anxious when they're actually experiencing early cardiac distress. I've seen women encouraged to rest when they truly needed more testing. And I've seen women brushed off because their symptoms didn't fit the mold. This is why awareness is powerful. When women understand how their hearts behave, they become stronger advocates for themselves. They can say, "This isn't normal for me," and insist on a deeper look. And when doctors hear patients speak confidently about their symptoms, it changes the entire direction of care. You deserve to be taken seriously. Your symptoms matter. And the more you understand your own body, the harder it becomes for anyone, including yourself, to ignore what your heart is trying to say. Early warning signs women commonly ignore. As we continue, I want to talk about something that breaks my heart each time I see it in my office. The early warning signs so many older women overlook. Not because they're careless, not because they don't pay attention, but because the signs are subtle, confusing, and often feel like a normal part of aging. And for decades, women have been taught to push through, to stay strong, and to put their own needs last. But your heart doesn't speak loudly at first. It whispers, and those whispers are worth listening to. One of the earliest signs many women miss is shortness of breath during simple activities. I often hear women say, "I'm just out of shape," or, "I guess this is what getting older feels like." But when your heart is struggling to pump blood efficiently, even small tasks become harder. Walking across a room, climbing a few steps, carrying groceries, these should not make you feel winded if they didn't before. When breathing feels heavier than usual, it's often a sign your heart is working overtime. Unusual tiredness is another symptom that's easy to dismiss. Every woman gets tired, right? Life is busy, even after 60. But the fatigue associated with heart strain feels different. It's a heaviness, a lack of energy that sleep doesn't fix. Some women describe it as feeling like they're moving through thick air. Others tell me they feel drained before they've even started their day. When your heart cannot deliver in enough oxygen-rich blood, the entire body feels it. Sleep disturbances are another overlooked warning sign. Many women think disrupted sleep is due to stress, menopause, or simply aging. But waking up breathless, restless, or with a tight feeling in the chest can indicate the heart is struggling while you sleep. Your heart works hard at night to regulate breathing and circulation, and when something is off, the body often wakes you up to signal distress. Then there are more unusual signs: swelling in the legs or ankles, persistent headaches, or discomfort in the neck. These don't sound like heart issues at all, yet they can be early indicators of reduced circulation or fluid buildup caused by subtle heart dysfunction. Women often blame these symptoms on arthritis, dehydration, or sleeping in the wrong position. But the body rarely sends signals without a reason. Here's a simple piece of science that helps explain it. Many older women have small vessel blockages, microvascular disease, that restrict blood flow in tiny but important ways. These blockages don't always trigger classic chest pain. Instead, they create slow-developing symptoms that build quietly over time. Fatigue, swelling, headaches, and breathlessness are the body's early alarms, asking for attention before something serious happens. The danger is that women learn to normalize these changes. They say, "It's just my age," or "I've always had this," and continue pushing through their day. But the heart deserves more compassion than that. The truth is simple. Your body always tries to warn you. And the sooner you listen, the more power you have to prevent bigger problems later on. You know your body better than anyone. When something feels different, unfamiliar, or persistent, it's worth paying attention to. Your intuition is one of the most powerful diagnostic tools you have. How hormones shape heart health. After 60. As we move forward, I want to talk about something that is often overlooked. Yet it plays one of the most powerful roles in the heart health of older women: hormones. Many women are surprised to learn how deeply hormonal changes influence the cardiovascular system, especially after age 60. But once you understand this connection, the differences in symptoms suddenly make sense. For decades, estrogen acts as a natural protector of a woman's heart. It keeps blood vessels flexible, helps maintain healthy cholesterol levels, supports better blood flow, and reduces inflammation inside the arteries. Think of estrogen as a gentle shield, quietly helping your heart stay resilient through stress, changes, and aging. But after menopause, that shield begins to thin. Estrogen levels drop, and the cardiovascular system must adjust. Arteries that were once flexible begin to stiffen. Blood pressure becomes more challenging to regulate. Cholesterol shifts in a way that increases risk. And the heart becomes more sensitive to any form of strain, physical or emotional. This hormonal shift is one of the main reasons women's heart symptoms look different from men's. Without estrogen's protective effect, the heart may respond more quietly, subtly, or unpredictably. Instead of sharp chest pain, women may feel breathlessness, upper back pressure, or unusual fatigue. Instead of a dramatic event, symptoms may come in waves or appear during emotional moments rather than physical activity. Hormonal changes also influence how women perceive pain. The nerve pathways that transmit signals from the heart to the brain are affected by shifts in estrogen, meaning discomfort may appear in unexpected areas, like the jaw, neck, or stomach, rather than the chest. This is one reason older women often misinterpret early signs of heart disease. Inflammation is another major factor. After menopause, inflammation levels naturally rise, even without illness. This can irritate blood vessels, destabilize plaque in the arteries, and make the heart more vulnerable to stress. A moment of emotional tension or a sudden spike in blood pressure can be more dangerous for older women than they might realize. And we can't talk about hormones without acknowledging their impact on emotional resilience. Many women notice that stress affects them differently as they age. Small frustrations feel bigger. Worries linger longer. Emotional triggers hit harder. This isn't weakness, it's physiology. When estrogen declines, the brain's stress response becomes more sensitive, meaning emotional stress can place real strain on the heart. I've seen this countless times. A woman feels perfectly fine during physical activity, but experiences heart fluttering during an argument or chest pressure when receiving upsetting news. Her heart isn't failing, it's responding to stress without the hormonal support it once had. Sleep also becomes more challenging after 60, and poor sleep creates a ripple effect of inflammation, blood pressure spikes, and hormonal imbalance. That combination puts even more pressure on the heart. Understanding these hormonal shifts isn't meant to frighten you, it's meant to empower you. When you know what your body is going through, you can be gentler with yourself. You can recognize that certain changes aren't just aging, but signals that your heart needs care, calm, and attention. Your body is not working against you. It's adapting. And when you listen closely, it will always tell you what it needs. Doctor-approved ways to recognize respond early. Now that you understand why heart symptoms look different in women over 60, I want to shift towards something empowering: how to recognize these signs early and respond in ways that protect your heart. Knowledge is powerful, but knowledge paired with action is life-changing, and every woman deserves the tools to take control of her heart health with confidence. The first and most important step is learning to listen to your body, not casually, not only when you have time, but with the same attention you would give a loved one. When something feels off, whether it's unusual fatigue, strange discomfort, or breathlessness you can't explain, pause and pay attention. Women often have a deep intuition when their body is signaling trouble. I've watched this intuition save lives more times than I can count. Start by tracking any symptoms that don't feel typical for you. You don't need a complicated system. Just note when symptoms appear, what you were doing, and how long they lasted. Patterns can reveal issues long before a crisis happens. If you suddenly struggle to climb stairs, or feel heaviness after meals, or wake up at night with pressure in your chest, write it down. These early clues matter. Next, understand when to seek immediate help. If you feel sudden shortness of breath, chest tightness, dizziness, cold sweats, or any unusual pressure that spreads to your jaw, back, or shoulders, those are signs to go to the emergency room. Don't wait. Don't convince yourself it's indigestion or stress. When in doubt, get checked. It's always better to be safe, but not every concern requires a trip to the ER. Some symptoms call for a scheduled appointment and deeper evaluation. That's why it's important to know which tests to ask for. Many women's heart problems, especially microvascular issues, don't show up clearly on basic tests. Here are the evaluations that give a clearer picture. A stress test can reveal how your heart responds under pressure. A coronary calcium scan shows plaque buildup that may not be visible otherwise. And if your symptoms seem subtle or confusing, a microvascular assessment can detect issues in the small vessels that are often missed. These tests are not about being dramatic. They're about being thorough. Responding early also means creating a relationship with a healthcare provider who listens to you. You deserve a doctor who takes your concerns seriously, especially when your symptoms don't fit the classic pattern. If you ever feel brushed off or dismissed, it's okay to seek a second opinion. Your heart is too important to be rushed or minimized. Most importantly, understand that recognizing symptoms early is not about living in fear. It's about living with awareness. It's about giving your heart the attention it has earned from carrying you through decades of life, loss, love, stress, and joy. When you listen early, act early, and trust your intuition, you give yourself the best chance of preventing bigger problems and maintaining the independence, clarity, and energy you deserve. Lifestyle habits to protect the female heart over 60. Now that you understand the hidden symptoms and early warning signs, let's focus on something equally important: the everyday habits that can strengthen and protect your heart, especially after 60. These habits don't require perfection or dramatic changes. Instead, they are small, steady choices that support your heart in the most compassionate and sustainable way. One of the most powerful tools you have is your daily nutrition. A heart-healthy diet for senior women doesn't need to be complicated. Focus on foods that nourish your blood vessels and reduce inflammation. Whole grains, leafy greens, berries, beans, and fatty fish like salmon or sardines provide fiber and omega-3 fatty acids that help calm inflammation and support circulation. When your arteries are healthier, your heart doesn't have to work so hard. Reducing sodium can also make a tremendous difference. Many women don't realize how much salt sneaks into everyday foods like bread, soups, and snacks. Lowering sodium helps regulate blood pressure, which becomes more difficult to manage after 60. And by choosing simple, whole ingredients more often, you give your body the building blocks it needs to stay balanced. Gentle, consistent movement is another key to protecting the heart. You don't need intense workouts. In fact, the most effective exercise for older women is movement that respects your joints and honors your energy. Walking, water aerobics, stretching, and light strength training can boost your circulation, improve cholesterol, and help your heart pump more efficiently. Even 10 to 15 minutes a day can spark meaningful change. Managing stress is equally essential. Emotional strain hits the female heart harder after 60 because hormonal changes make the nervous system less resilient. Simple practices like deep breathing, meditation, journaling, or spending time in nature can lower your heart rate and reduce inflammation. You don't have to master these habits. Just practicing them gently and consistently helps your heart find its rhythm again. Sleep is another pillar many women overlook. Rest is when the heart repairs itself, regulates blood pressure, and restores hormonal balance. Creating a calming bedtime routine, keeping your sleep environment cool and dark, and listening to your body when it asks for rest can transform your heart health over time. Hydration is also a quiet superpower. When you're dehydrated, your blood becomes thicker, forcing your heart to work harder. Drinking enough water throughout the day supports circulation and keeps your heart functioning more smoothly. Finally, be mindful of medications and supplements. Some stimulants, decongestants, and herbal remedies can raise heart rate or blood pressure in older women. Always check with your doctor if something doesn't feel right after starting a new medication. What I want you to remember most is this: protecting your heart isn't about doing everything perfectly. It's about making small, consistent choices that remind your body you care. Every healthy meal, every walk, every moment of calm, every night of good rest, these are gifts you give your heart. And your heart, even after 60, responds with strength, resilience, and gratitude. When you treat your body with kindness, it rewards you with energy, clarity, and the freedom to live the life you love. As we bring this conversation to a close, I want to leave you with a message I hope you carry into your everyday life. The symptoms we've talked about today are not signs of weakness or failure. They are signals. They are your body's way of whispering, calling for care, nudging you toward awareness. Your heart is not trying to frighten you, it is trying to guide you. And even after 60, even after 70 or 80, the female heart remains incredibly resilient. It has carried you through decades of joy, grief, responsibility, stress, love, and change. It has adapted again and again, far more than you may realize. If anything, your heart is stronger than you give it credit for. But strength still needs support. And awareness is the first step toward giving your heart what it needs. You deserve to be heard. You deserve to be taken seriously. You deserve a healthcare experience where your unique symptoms matter and your intuition is trusted. I want you to promise yourself that the next time something feels different, unfamiliar, or unsettling, you will listen. You will not brush it aside. You will not convince yourself to push through. Your intuition is one of the most powerful tools you have, and it has saved more lives than any single test or machine in my office. Take a moment to feel gratitude for your body. For every mile it has walked, for every burden it has carried, for every memory it holds. It has worked tirelessly for you, even on the days you barely noticed. And as you move forward, hold on to this truth. Your heart wants to keep you here, strong and present, living fully in the moments that matter. If this video has helped you feel clearer, more empowered, or more connected to your own body, I invite you to stay with Senior Health Daily. We are here to guide you with compassion, clarity, and unwavering support as you continue your journey toward long-term heart health and peaceful aging. You are not alone, and your heart is worth protecting.